Hello and welcome to Strat News Global and welcome to The Gist, our signature evening show on foreign affairs and security. I'm Surya Gangadharan, and this evening we are looking at the pandemic, which is in the second surge all over India, although indications are that the intensity is declining. I have with me Dr. Srinath Reddy, President of the Public Health Foundation of India. He's a well-known, he headed the cardiology department of the All India Institute of Medical Sciences. He's a well-known doctor and epidemiologist in his own right, and is a frequent commentator on the issues relating to COVID. So welcome, glad to have you.
Thank you.
Before I begin the questions, I'd like to begin with a quick graphic giving an update on the COVID situation in this country at this present time. This graphic that you're going to see gives you the total number of cases. As you can see there, over 2 crores. Active cases, 32 lakhs plus. Recoveries, 2 crore 19 lakhs. Deaths, 2 lakh 83,000. And that's what you have right now. We also have a bite from Dr. Harshvardhan, who's the Union Health Minister. This was taken yesterday, and he was projecting an optimistic
Some
scenario.
significant decline in the number of cases, but we have to keep ourselves thoroughly vigilant, prepared, and there can't be any room for complacency in any form.
So, Dr. Reddy, let's get back to you now. What do you make of these figures? What's your reading?
Well, I think there is definitely a downward trend, but we have to depend upon multiple indicators to come to that conclusion. The number of cases declining on a day-to-day basis is certainly an encouraging indicator. However, that also depends upon the nature of testing being done and the number of tests being done and the indications for those tests. If we have the tests being done in the same numbers every day, it helps to compare over days. But more importantly, if we also adopt the same type of tests, if the ratio of RT-PCR to rapid antigen tests remains the same, then again it inspires more confidence, because if you switch to predominantly rapid antigen tests and reduce the number of RT-PCR tests, then you are likely to get many more false negative results. That means you may be missing more cases. So then you may get a spurious impression of a downward trend. So we do need to adjust for all of these. But that alone is not the only indicator. We ought to look at what is happening in terms of daily deaths as well, whether those are coming down, diagnosed or even otherwise. And that helps us also to get an idea whether there is a change, though the deaths usually tend to lag behind the cases by about 2 weeks in terms of their decline. But one of the more sensitive and meaningful indicators is also what's happening in terms of the hospital admissions. If there is a huge rush for admissions in the hospitals, especially those requiring oxygen or intensive care, ventilators, and so on, and if that has now tended to come down, and if there is less number of admissions being refused, and there is a less hue and cry that people are unable to get admissions, unable to find oxygen, that again is a very, very encouraging indicator that indeed the caseload is coming down, because when the caseload comes down, the number of serious cases come down. And at least in the big cities, we are seeing that this is definitely the trend. In the areas which started initially on the second wave earlier than others are now beginning to show a downward trend, whereas other areas which started later, particularly the small towns and villages, are still caught in the throes of the second wave.
Are you confident about the figures?
I'm not, but for trends, you have to see whether there is a decline, even if there is a certain degree of undercounting. It is not the
Hmm.
precision that matters that much as the trends. Now, there is a noise to signal ratio. If we say that there is a undercounting by a factor of 3 or 4 or 5, whatever may be the guesswork of the so-called modelers, still, if there is a downward trend and the noise to signal ratio remains relatively constant, as it does in the case of deaths or in the case of hospital admissions, then you definitely can say that there is a downward trend. You may not get absolute precision in terms of the numbers, but the direction of the pandemic can be traced by this, as long as the noise to signal ratio doesn't change too much.
Hmm. So when you compare the current stage of the pandemic here with overseas, what is it that what are the conclusions you draw?
Well, it is true that others too have experienced their second wave, and some of them have experienced their second wave with a considerable degree of ferocity.
Yeah.
But their second waves, at least in the West, were not characterized as much by the dominance of the variants, which are much more infectious and much more also likely to be virulent in terms of the severity of clinical manifestations.
Hmm.
And therefore, we have been caught with the unfortunate predilection of having to deal with not only the original virus but multiple variants. But also remember, our second wave came when we had fully opened up our society in
Yeah.
almost an exuberant fashion. We went around with a large number of crowds. I'm not going to go into the litany of what all happened in terms of elections to local bodies and state assemblies and religious
Yeah.
festivals, but even things like weddings and family celebrations, travel, everything was unrestricted.
Yeah.
So the virus and the variants, all of them had a super highway to travel. Whereas in the West, they did still observe some precautions. And therefore, partly the relative late entry of variants into the Western countries and the fact that they did not fully open up in an unrestricted manner reduced the damage from the second wave, whereas we left ourselves fairly exposed.
The shortages that we witnessed, and the terrible scenes in hospitals, the oxygen, even vaccines today. I mean, does that tell you something? I mean, you've been in this field now for many years. I would presume that administrations are generally wary of ensuring that shortages of any kind during a medical emergency are not there.
Well, generally, you do contingency planning, and I think they did the contingency planning quite well during the first wave.
Yeah.
And they managed to do it. Of course, the first wave did not put as much pressure in terms of numbers on us as the second wave has. But I think because the second wave was not anticipated, certainly not by many of the agencies, and it was not anticipated to be of such a high surge, of a sudden rise in numbers, which challenged the health systems of the country. I think we were caught short. But remember, some
Mhm.
of the Western countries too were caught short when they had a huge surge in 2020. But I believe if we had prepared a little better and if we were not caught by our complacency thinking that we will not have a second wave, at least if that was the general feeling in many quarters, then we might have been better prepared and got away with less degree of, shall I say, damage in the second wave. But nevertheless, it was a ferocious surge, and it was possibly difficult for most health systems to handle in the manner it came.
How bad do you think the third wave could be? There's already talk that it may have already hit the villages in parts of many parts of India.
Well, there are many variables in this. Firstly, we only talk about how much the virus has actually infected the people, and then say, okay, it has already infected the people. But we have to talk about two things: how has our body behaved and how has our society behaved, not just the
Hmm.
behavior of the virus. So, how
Yeah,
long
yeah.
is the immunity going to last if it is a natural infection? How many of us are getting vaccinated to build up better immunity, which is going to be stronger and will last longer? Then the third element is how much of public health precautions are we going to still continue to observe? Like, for example, ensuring that we avoid super spreader events for quite a few months to come. And even if physical distancing is not possible, can we continue to mask till a substantial number of our population is vaccinated? Then can we ensure that we try and function as much as possible in better ventilated places, either at home or in offices? So these are the kind of things that we do need to have as our precautions in order to reduce the level of transmission. And unless we do that, the third wave can also be problematic because the immunity of natural infection will start declining, and enough number of people would not have been vaccinated by then to build a stronger level of immunity. But if we do observe these precautions, we can actually succeed because we know for sure that even in Britain, when they had their wave in November, December, as Prime Minister Johnson said, they actually managed to bring it down and control it, not so much by the vaccinations, but by the lockdown. That
Yeah.
doesn't mean we have to go into lockdown every time, but we have to observe a fair amount of precautions in terms of the degree of mobility and the degree of crowding that we are going to have.
Would you say that community transmission is something that has been happening for some time? It's a word that government has generally kind of stayed away from.
Well, if you go by the usual definitions of community transmission, where you say that unless you can reliably identify the source of the infection in terms of where the person, who he contacted and where he contracted the infection, you have to declare it as a community transmission. And particularly now we know that it spreads by aerosols. It doesn't have to be you and me meeting at
Yeah.
3 feet distance. It can be aerosols floating from room to room. Of course, in ill ventilated places. I believe we have to accept that we will not be able to identify the source of the infection for the many of the people who have been infected. So whatever be the nomenclature that is being attached to it and whatever be the hesitancy in doing so, I think the strategy for countering it will remain the same. We have to definitely ensure that we actually adopt all the protective measures to prevent transmission.
Yeah, and I'd like to play a graphic of a quote by Dr. Jailal, who is the president of the Indian Medical Association. He was spelling out in some detail some heavy focus on vaccination. And this was yesterday. Can we just
Us
have
is
that
only vaccination.
graphic?
If we are not pushing for the mass vaccination, by all means, it is not going to be safe for us to face the third wave, which is bound to occur.
So there we are. So we have to step up vaccination. Do you agree that we are now stepping that up, or is the shortage of vaccine holding us back?
Well, I think it's generally acknowledged by everybody that we are seeing some shortage of vaccines. It has been also admitted by several people in the government, in the public domain, that extending it prematurely to everybody above 18 was perhaps not a good idea. We should have still continued to focus on the people above 45 years of age and the people under 45 who were particularly vulnerable because of comorbidities or associated health conditions. And we suddenly opened up to everybody, and we are finding ourselves relatively short of vaccine supplies for a variety of reasons. So we have to definitely ensure that we get adequate supplies from abroad, because now some of the states have gone in for global tenders, and even government of India is trying to find out which are the international sources who can supply us. Fine. But by August, if we are able to really ramp up the production of the vaccines that have already received regulatory approval, and if we can also get more of the new vaccines currently under trials past the regulatory approval after completion of the trials, then it's likely that our position may improve and we may be able to vaccinate more people and at a faster pace. But till that time, it is going to be a bit of a challenge in terms of how much we can access internationally, because it's not that global supply chains are very full either.
Yeah,
There is hot competition between high income countries and middle income countries for those vaccines, and the low income and the low middle income countries are being left behind in that competition.
you think our vaccine makers are geared up now? They need to be given some time, isn't it?
Yes, definitely. The vaccine makers are gearing up now, but you can't suddenly jump from second gear to top gear.
Yeah, yeah, yeah. So, what happens in this interim? You're saying August is when we start ramping up vaccination. In this interim, next 2 months, what do we do?
In the interim, I think we can resume some economic activities when we are fairly sure that we have got our systems in place during the lockdowns or the partial lockdowns that have been imposed. But everybody has to observe personal precautions.
Yeah.
Nobody should step out of the house without a mask. And if somebody has to meet or function in a relatively ill ventilated or a closed space, it's better to double mask, even for transport or in a building where offices are located. As far as possible, we should avoid people staying in large numbers in a crowded building for a long time. We may have to have working shifts, just as if for schools also we may require different shifts so that we reduce the numbers. But avoid at all costs super spreader events. We should not have super spreader events involving rallies and processions and large scale celebrations. That is something we should actually put behind us for at least till the end of the year.
The extension of the time between the first shot and the second shot, is this driven by the shortage of vaccines, or is there a medical reason here?
Well, actually, it's interesting that even the UK did it, and UK did it first.
Okay.
If you look at the AstraZeneca vaccine dosing schedules, even in the trial itself and after the trial, there's been a bit of a tap dance around that, because
Uh-huh.
they had planned a trial for 2 full doses at 4 weeks interval. Then they ended up with a smaller strand in the trial, some of who received half dose first and the full dose next. And then some people also received the second dose after 3 months, that is 12 weeks. And to their own surprise, they found that the people who received after 3 months had a higher level of immunity. And then they started looking at immunogenicity experiments and said, okay, if you space out more, you are likely to get a stronger immune response, that your booster dose will actually get much better results. So then it also suited Prime Minister Johnson at that time to announce almost on the same day, 30th of December, to say that we will administer at 3 months interval because we want to vaccinate as many people as possible with the first dose, give them at least some level of protection. So that is a strategy that has been followed by some people, and even the WHO accepted it and made it 8 to 12 weeks. Now we have extended it to 16 weeks because one of the groups in Spain actually went up to 16 weeks interval. So the whole idea here is if you delay a bit, you may get a better immune response from the booster dose. But that's not from the trials. That is after the vaccination and other immunogenicity experiments. So there is some scientific rationale for this, but we can't stretch it beyond that.
So, going forward, what is it that you would what is it that you would advise the government or advise people at large on what to do?
Well, I think we do need to ensure that we do not allow the virus a free passage. So people should protect themselves with masking and as much of physical distancing as is feasible, and avoid ill ventilated places and certainly shun crowds. So that is a very important message for every individual. Then the administration should ensure that super spreader events are prevented, and we ought to try and reduce the amount of travel between urban areas and rural areas, because even now the rural areas to some extent can remain protected despite the entry of the virus, because they have some natural protective mechanisms. The crowd density is less. They don't live in high rise apartments which are crowded together. They live in relatively open houses. They work in open fields. They don't commute as much within the village or between villages. So some of the natural advantages that we have, we must try and retain. And also the levels of comorbidities like hypertension, diabetes, and heart disease are lower in the rural areas, except in more economically developed or also more urbanized states. Some of the more urbanized states like Maharashtra, or where urban rural connectivity is much more and the differences in development are less, like Kerala, there you will see the rural areas more affected. But many parts of northern and central India, you will still see that the developmentally backward rural areas are paradoxically better protected against the virus if we can reduce the urban rural transmission.
So you wouldn't expect the same level of perhaps tragedy that we've seen in the cities and towns. You wouldn't expect that to happen in the villages.
I would not expect the level of infection to be as serious in as many people, but
Okay.
unfortunately, because the healthcare facilities are far poorer in the rural areas, that is where we are going to pay a price.
And going forward, would you think that you've written about this, about a healthcare system? Would this COVID experience help us build a better healthcare system?
I hope so. I earnestly desire that it will happen. Previously, whenever any public health emergency came in, I mean, whether it was children dying of encephalitis, or whether it is Nipah pandemic or anywhere else, for example, whatever happened, or even H1N1 coming in 2009, the attention span was relatively little because whatever the threat was passed off in a couple of weeks maximum. And then everybody forgot about it and went back to life as usual. And health receded into the background
Yeah.
and was continued to be deprioritized. Now that we have lived with this pandemic for more than 1.5 years almost, and we are also seeing that this is going to continue for the rest of the year in one form or the other. We are seeing that the variants of the virus are going to keep us busy, even possibly for some time in 2022. And the economy is actually sluggish because of this reason. I
Yeah.
think there will be a lot more attention paid to health now and of strengthening health systems so that we avoid some of the pitfalls. Because one lesson I think that has gone home, at least I hope so, to everybody in the world, including policymakers and even leaders of economy and the opinion shapers in this country, is that if you continue to neglect health, the economy will continue to slip on the banana peels of public health failure.
On that positive and hopeful note, Dr. Reddy, thank you very much for that insight and the information you've given. Let's hope the government learns the lessons and moves forward in a more purposeful manner with better direction. And given the experience of the last year, they'll be more tuned to what is happening on the ground and take proper measures to check the flow of the virus. Thank you again, Dr. Reddy, and for all of you out there, keep watching us on The Gist. Follow us on Instagram and Twitter and other social media. Keep forwarding us your comments and observations, and do keep watching. Thank you very much.